Good day, everyone. I am Max, the moderator for this webinar. I welcome everyone to today's webinar, CMS QAPI 2026 Strong Systems for Compliance and Quality Improvement. I want to introduce our presenter for today, Dr. Michael C. Redmond. Dr. Michael C. Redmond, PhD, MBA, is a respected consultant and auditor with more than 15 years of experience in regulatory compliance and information protection. I would now like to hand over the floor to the speaker. Over to you, Dr. Redmond.
Thanks so very much, Max. So today's topic, CMS QAPI 2026, Strong Systems for Compliance and Quality Improvement. We'll be covering the requirements, designing a compliant program, effective data collection and validation techniques, identifying preventing deficiency patterns, integrating performance integration projects, strengthening internal audit and monitoring processes, leveraging QAPI for data and organizational culture change, practical tools and resources, shareholder engagement and communication strategies, and preparing for the survey and long-term compliance. So some of the updates for 2026 are there's enhanced data integrity. So some of the hurdles that are ahead, this is not an easy task. So you have to maintain accurate data across the various healthcare systems. That's a major hurdle. So some of the priorities, you want to integrate data and action. So the purpose is CMS mandates QAPI to drive continuous quality improvement. So these are some of your standard timelines. I've broken them out into the 4 quarters, which is the way it's been broken out so that you can actually manage this process. So quarter 1 is broader stakeholder engagement and program scope. So when you're looking at the indicator refinement, you want to clarify the intent. So when we're looking at real-time data, it's information that's captured, processed, and made available with no meaningful delay, allowing decisions to be made immediately rather than a reporting cycle. Remember, when you're dealing with QAPI, it detects deviations in care processes before they become incidents. So when you have the digital and EHR integration, you'll want to electronic records integration to streamline compliance and audits. So some of the implications, healthcare organizations have to invest in robust data analytics systems. So when you're dealing with the CMS QAPI alignment, some of the areas that you'll want to consider the most, using quantitative data to assess performance and identify quality areas. So QAPI roles and responsibilities. The leadership, they set the vision, they allocate the resource, they remove barriers to drive the priorities. They oversee compliance, they review performance, and they steer continuous improvement for the quality committee. Your clinical staff implements interventions, monitors outcomes, and escalates issues priority. So data collection and validate and collection. You have data acquisition. You're collecting from EHRs, automated tools, and manual entry. That's your AI, not a public one. Standardized protocols. Apply consistent procedures to ensure accuracy and reduce errors. You're doing staff training. You're educating personnel on best practice for reliable capture. So you're implementing data validation. These include audits, cross-verification with source documents, automated error detection algorithms, extremely important. So root cause analysis methods. So some of the proactive things you want to do is staff education. So the prioritization is high impact, low effect. That's a quick win. So effective improvement design. You need leadership commitment, open communication, transparent dialogue between staff to raise concerns without fear of reprisal. So it's continuous monitoring. You want to have real-time data dashboards, live reviews of streams and trends, high deviations as they emerge. So some of the feedback loops. So you're fostering accountability and transparency. So technology and solutions. So you have comprehensive QAPI tools for data collection, validation, reporting, and management in one workflow. So sample templates and documentation, you have data collection templates. So some of the training resources you'll want to do, webinars such as this. You want communicating your goals, consistent messages across dashboards, newsletters, and meetings. So feedback mechanisms, you can be using surveys. You want policies. We're just doing a review now. You have to understand the QMS QAPI 2026 in detail, design robust programs, leverage data effectively, foster accountability and readiness. Just want to thank everybody, and I certainly appreciate your attending today's webinar, and I look forward to seeing you at our next webinar. Thank you very much, and thank you for having me today.
Thank you, Dr. Raymond. That's conclude the session for today. And thank you everyone for participating. You may all disconnect now. Have a great day ahead.
Bye-bye. Thank you.